Hey everybody, this is Jason. Just going to wait a couple more minutes for some more people to join and then we'll get going. Thanks for submitting all your questions. Hopefully I'll have them answered before the end of this call. All right, everybody, we're going to go ahead and get started. It's a couple minutes after 3. Thank you, everybody, for joining. So this first screen, you should be looking at me, or that's how I looked last year anyway. So we had a bunch of questions come in. Appreciate everybody's participation. At the end, if we have a few minutes, I can answer other questions. There's a question and answer section on your screen. You should be able to ask some things. If we have time, I'll go over that stuff as well. So this is me. If everybody could just please read the disclaimer. So I'm not trying to give anybody specific treatment. This is just my educated opinion on the information that's currently available, kind of help us negotiate this disease process and kind of apply it to our everyday situations. So I guess most everybody who's on here knows My Choice Housecalls. We're an in-home primary care service, and so we treat many residents. A lot of the questions that I got were in reference to assisted living or communal living for seniors or our frail elderly who are the most affected by this disease process. So My Choice Housecalls was created in 2015. I've been a nurse practitioner 16 years, been in the Jacksonville market about a decade. Most of my experience, I was emergency room, urgent care, but most of my experience is house calls. Currently, My Choice has about 3,000 patients in the market, and we're expanding just about every month. So just keeping it in perspective, I know there's a lot of fear, a lot of rumors and things, but this comes straight from the CDC's website. As of yesterday in Duval County, we've had 29 deaths. So 1,171 cases. So as you can see, people recover from this disease process in general. People recover from this process. So there's a little bit of Florida data on this. If you go to the CDC website, you can, any city that you want, any state that you want, you can look that up and get more information. So moving on to the questions that we had, the first one that came through, basically asking who's going to get it. So, not to sound snarky, but you're probably not going to get it, but you might. And if you do get it, you're probably not going to die from it, but you might. It just depends on some of the things that are listed here. So for most, the risk is thought to be low. It's basically people who have underlying health problems. We'll talk a little bit more about the young population that has passed as well. So we'll talk a little bit about that in a bit. But basically, older folks with chronic conditions, those in long-term care, assisted living facilities with specifically lung disease being one of the number one indicators. Diabetes is another, but you can read some of the other things there. And a whole lot of questions about my opinion on the mask situation. So, what I always say is that, we follow CDC recommendations. When patients call the office, when families call, when you guys call, we're following CDC recommendations. So they are recommending that everyone wear at least a cloth covering while they're in public. That social distancing measures, do this whenever social distancing measures are not feasible. So common cloth is fine. Something you can throw in the washing machine is completely fine. And it's a good idea. Plus it's more comfortable than the N95 or surgical masks, which in general should be reserved for critical workers, hospitals, employees in the facilities, those type of people. So why do we wear the masks? It's just to slow the spread. So, if I've seen a good analogy where if you are standing, or if you're with a patient who urinates and you have no clothes on and they have no clothes on, then you're going to get contaminated. If you have clothes on and they have clothes on, you're limiting risk. So we're just trying to eliminate or slow the spread and keep those who don't know they have the virus from spreading it further. A little bit about one of the questions was how do we take care of our safety equipment? So, if you're following those CDC's recommendations for a cloth covering, when social distancing measures are not feasible, just something you can put in the washing machine. No need to wash it separately. You can wash it in warm or hot water and dry it in a regular dryer, and that should eliminate any virus on your item. It's a little bit more difficult with surgical masks and N95 masks. They're meant for single use. I know a lot of people are reusing them, just because of the shortage. But if surgical masks have to be used, they can be stored in a non-airtight container for 3 days and then safely reused. The N95 masks, they're still doing a lot of data about this. It looks like that vaporized hydrogen peroxide, spraying that on and letting it dry, that's most effective, and you can do that up to 3 times. I'm not sure where they got the 3 times, but basically, that type of thing. I've also seen some YouTube things where they're talking about just using antimicrobial soaps to gently wash them, but it's thought that any other measures can break down the mask, make them more loose, and so you're lowering the level of protection that they provide. All right. So, can I get coronavirus from someone that has recovered? So there's not a whole lot of data about this either. So I think that's part of the problem with this process, is that it's new to the medical community. It's new to us here. And so they're still trying to figure it out. But, it's generally thought that once a patient is released from quarantine, that they're no longer a threat to any of us. You can run the antibody test. It takes 1 to 3 weeks for the antibodies to show up in your system. But we don't know if even if you have the antibody, if that protects you from getting the disease again. It is believed that it's not, if a person is now negative and they've been out of quarantine, that they can't give it to you. But we don't know if it protects them, if the antibody protects them from getting it again. So no matter what the underlying conditions are, the advice still stays the same. It's just washing your hands, reducing exposure, social distancing, and even people with mild symptoms just need to stay home and recover, not seek treatment unless you have specific, more severe symptoms. And I think at this point, we're all familiar with what those are. All right. So another question about how often patients should be tested. So first, I'll talk about the 2 types of tests. There's the viral test that shows active disease. We're all familiar with that one. We've been doing this for weeks. The antibody test, newer to this market, showing previous infection. Again, we don't know. We know it takes a while for that to show up in our body after infection, and we don't know if it'll keep somebody from getting the disease again or from being able to pass it along to others. So that data is not available yet. So again, following the CDC recommendations, most people with mild illness can stay home, recover without medical care, and do not require testing. The CDC website has specific guidance that you can look at for specific patient groups. But in general, without severe symptoms, there's no benefit to being tested. So again, should asymptomatic patients be tested? I get this question, I would say probably 5 times a day. Some facilities are requiring now that everyone who enters the building be tested and be negative before they enter the building. There is no protocol. So, what I ask myself, and I'm sure the other providers in the group will ask themselves, like, when you have a practice or you're following a practice, you need to ask yourself, what is the recommendation by the CDC that I'm following right now? Like, what rule set forth by the CDC? What am I following right now? So there is no protocol about treating asymptomatic or testing asymptomatic patients. So a couple of questions about the whole ventilator versus oxygen as far as treatment. And so you can read through some of this. Ventilator use is driven almost entirely by the level of oxygen in your body. So people with low oxygen saturations, extremely low, typically have symptoms, and that's where the COVID patients are different. They don't have the symptoms that regular respiratory distress people with, adult respiratory distress syndrome have, or people with pneumonia. It's a different pathology. So when you're thinking of, when you're thinking of treatment, think altitude sickness versus pneumonia treatment. So, we put people on ventilators when they have low oxygen, but in some cases, with these high levels of force and high levels of oxygen, it actually damages the lungs and makes them harder to recover. There's very, very low or much lower survival rate amongst patients who've been on ventilators with the disease rather than patients that have not been on ventilators. So current data is suggesting we use non-invasive respiratory measures such as oxygen by nasal cannula or BiPAP, and just kind of waiting. These patients can improve their oxygen slowly, and have a little bit better result. But of course, if somebody's, oxygen saturations are dropping and their physician believes that they need to be intubated, then, they're still using this intubation, but the risk of mortality with that is higher. A lot of questions from the facilities about if somebody's positive. There's a lot of facilities and a lot of management companies that are requiring that all patients in the whole facility be tested. I personally don't think this is a good, I don't think it's necessary. I think it's a waste of resources, but if someone's found to be positive without clinical symptoms, they want to know, what are we doing and what should they do? And so overall, again, following the CDC recommendations, if you have an at-risk patient, they need to be wearing a face covering when they're around other healthcare workers. If as practitioners in my practice, if they become symptomatic, we've been fortunate. We've not been, that we haven't had a provider be symptomatic. But our policy is that we will test them immediately. They'll be quarantined until the test is negative. And then we go from there. But again, following the CDC recommendations. In the facilities, I think just about every facility we go to, everybody's being screened with questions about exposure, about symptoms. They're having their temperatures taken. If a resident is positive, obviously they need to be treated by healthcare providers that are wearing full protective equipment. If they're negative, you still need to wear a mask and use standard protocols, washing your hands, not using gloves over and over in different rooms. The CDC is recommending that we have dedicated teams. I know they're doing this in the hospitals where, the same nurse would have the same patients night after night or day after day, consistent staffing so that, the patients or residents are exposed to fewer outside germs. And then of course, there's standard protocol with, masks and, face coverings and gloves as needed with, good hand washing. So, and then for those of you who are doing admissions in facilities, isolating the patient or the resident if there is unknown exposure. So if you don't know, they need to be isolated for 14 days and be treated as if they're under quarantine until we can better ascertain their status. So, like I said, again, for most, everybody needs to stay home and recover. And if you have symptoms, follow recommendations. So now, something I've heard a lot in the community the last, several days over the last week, I guess, is that, now that quarantine's over, what can we do? So quarantine is not over. I think that, taking measures to flatten the so-called curve are still important. We need to follow recommendations by our states and governments, what they're asking us to do. But, can patients travel safely to get their haircut, to go to restaurants and exercise? I'm choosing not to do this myself and with my children at this point. Just because, again, we're trying to limit exposure. I think that's best practice at this point. So if someone wants to get their haircut and the beautician is wearing a face covering and the patient is wearing a face covering, lower risk, of course, but avoiding that so-called overexposure is still going to be your best strategy. So I think there are a lot of psychological effects going on with this right now, especially in our seniors who are like completely isolated. So if getting out to get a haircut, going to a restaurant, being able to exercise, I think, just limiting these things to avoid overexposure until we get a little bit more data about the progression of this whole process. All right. So a couple of people wanted to talk about the younger patients that have died, and they wanted to know if I believed it was due to overexposure. So the answer to this is I don't know, and I don't think anybody else does either. I think as these individual cases, which are few, as they're studied more, we may find out a little bit more about their health habits, or pre-existing medical conditions. But there are a few different ideas about why, the young people may have died with seemingly no chronic, these severe chronic comorbidities. So, obviously anybody with, like a gene variation, decreased surfactant in the lungs, which helps us clear, these viruses, inflammatory storms. So young people have very reactive immune systems. And when they get these viruses, it can just the immune response, the inflammatory response can overwhelm the heart and the lungs. Um, just my personal opinion, I think the last point on here, the younger folks are less disciplined in the social distancing. I think you all probably all seen that in our community. The seniors are all, staying inside, and our younger populations are all, still, kind of dodging the guidelines set forth by the city and our governments. So I think, if I personally, I think that we're going to see more of that, or that they just didn't know they had these underlying health conditions because they're young and they still feel pretty good. So that's my personal opinion. But here's some of the things we just don't know the answer yet. So vitamin D and COVID-19. A couple people asked about this one. So vitamin D is a water soluble vitamin. It's not going to hurt anybody. You need vitamin D to absorb calcium. I think in general, it's a good supplement to take. Early on, I read where this could be helpful, so I've always taken it. Now I have my kids on it. Like it says, water soluble. You're not going to overdose on vitamin D. It's thought because it helps protect your immune system in general. So it's thought that it can help be protective. So I believe that it's a good thing. And then a couple questions about this new normal. So, what will the new normal be for healthcare? I mean, I don't know. I think we're all experiencing a definite deviation from the old normal, whatever that was. But, with this being a new process, my opinion is that, as people, or as new diseases emerge, and, these pandemics are going to come and go, and, and the world is going to change every time that it happens. And so what we're learning now about this disease, which thankfully isn't proving to be, as deadly as they initially thought here for us. But, we're learning new things, new treatment protocols. I think that our governing bodies are recognizing the importance of telemedicine and telehealth. Remote patient monitoring is going to become larger, where we actually have equipment that will place in the residents' or patients' homes where they can be monitored remotely, thus not exposed to, whatever the healthcare providers could bring to them. We're facing shortages of protective equipment, medications, and so I think the FDA and the CDC will be, putting forth more guidelines about how to better regulate those things. They're changing some things with the billing. They've lifted, restrictions on extended providers, nurse practitioners, and physician assistants on how, what we can do in our practice. I think they're looking at increasing hospital capacities, lots of new technology, even just in the telehealth medicine spectrum. I mean, my choice has grown. We didn't even have a telehealth medicine protocol because it was not a thing in Florida, wasn't approved until this all came along. So I don't know what the new normal is going to be, but I think that, we're all learning how to be safer. And, a lot of what, they're recommending that we do now, nurses have been doing for years and years. So that's my opinion. All right, so that was my presentation. I'm going to go over here to the question and answer section here. Any thoughts, metrics being used to determine? So the question is, hello, any thoughts on, is there a metrics that's being used to determine when a community facility is determined cleared from their COVID-19 positive environment status? So the answer to this is, I don't know. I think I have not heard this. I think, there's a lot of questions when we come into facilities. Have your providers been exposed to COVID-19? I mean, we won't know unless they're symptomatic. I think all of the providers have been exposed at one point or another in a facility, but none of us have, had any symptoms or tested positive. So I think that, this goes back to my statement where people are saying that the quarantine is over. The quarantine is not over. The investigation is not over. And so I think that they'll put forth, they'll make it more clear if these facilities are cleared. And I would imagine they're going to have things just like with the other airborne diseases, Legionella, that's been in a couple facilities locally. They'll have, measures where, you have to report and get cleared. So that answers that question. All right. Well, I want to thank you guys so much for listening. If you guys have any other questions, I think everybody probably has my cell phone number. You can text me a question. If I don't know the answer, I'll try to figure it out. Everybody, thank you for attending. Be safe, and let us know how we can help. Take care.